I'm Dr. Todd Murray, and I am the Medical Director of the Emergency Department here at Peace Harbor Hospital. Peace Harbor Hospital is a very interesting place to work because even though we live in a fairly small town, we actually have a lot of high acuity of patients we see here. We see a lot of elder geriatric patients who have complex medical problems, and also because we're a vacation destination, we see a lot of tourists, many of whom come here and do fairly, shall I say, risky activities and injure themselves. So we have to deal with a lot of trauma in the summertime or whenever the weather's nice, and for that reason we often see a lot of very sick or injured patients in our ED. So this ER is now going to be almost 30 years old by the time it gets replaced, and it really shows this ER is really inadequate for the task that it needs to deal with today. Number one, the size is just far too small to deal with the problems we face today. On a busy summer weekend, oftentimes we just don't have the capacity to put the patients in the rooms and get them seen, and that can be really dangerous. Last year I had a situation where there was a minivan full of students from the University of Oregon that overturned, and it was already a busy day, and we had, I don't know, 7 or 8 patients coming in who were all injured, and it was really a challenge to get them adequately taken care of because of the space limitations. And that's something we face very often on busy days. And it can be very much a patient safety issue. If you have all your rooms full and suddenly 2 ambulances go out and one of them's a stroke and one of them's a heart attack, you're really facing a difficult situation. To do modern emergency medicine, for example, on a trauma patient, you need enough space to have an ultrasound machine, an EKG machine, perhaps a ventilator, as well as a nurse, a physician, a respiratory tech, and phlebotomy, other people. Right now we have small rooms, and our acute rooms have 2 beds per room. So when you're dealing with an acute patient who is sick and needs a lot of things done, there's simply not enough room to get everything done. We can't get the X-ray machine in. It's hard to get the ultrasound machine in. It's really, as a physician, sometimes I'm practically using my elbows trying to jockey for space just to get to see the patient. So that's kind of a safety issue there as well. The other issue related to that really is patient privacy, because 4 of our rooms have 2 patients that are together, and that's really just not adequate and unacceptable in terms of modern or today's expectations in terms of patient privacy. It's unfair to patients to be interviewed or sitting waiting in a room when the patient in the next bed, who again is 3 or 4 feet away, may have a bad pneumonia and may have a hacking cough. This happened just the other day, where a woman was seen for back pain, and there was a patient waiting to be transferred who had pneumonia and was coughing up a lung, and I could tell she was very dissatisfied with having to sit there and be next to another patient like this. So these are fairly urgent issues that I think need to be addressed. So I see the need for us to update from a 1980s ED to an ED that's ready to face the future, and that has the appropriate capacity, the appropriate technology, the privacy for the patients, and that can allow patients to be cared for in a healthy and safe and caring manner, which is a challenge today in today's ED.
Hi, my name is Sue Scarberry, and I'm the Vice President for Patient Care here at Peace Harbor. I'm an RN, and I've been here for almost 40 years, so I know the region pretty well, and I have a deep love for the community and their healthcare needs. I want to talk a little bit about our emergency department. We are in need of some big changes in our department. My concerns lie with safety for patients, first of all. I worry about space, and I worry about our employees if they have a good working environment. And I'd like to talk a little bit about the space. We have a 6-bed ER. We have 1 bathroom. We have shared rooms. During an emergency, a truly critical trauma or a cardiac event, our staff are literally running into each other. They're doing their very best, they're very qualified, but minutes and seconds and minutes are sometimes lost because they can't get around each other to get the equipment they need at the right time, even though we have it hanging all over the walls. So I think we need more space to deliver care as safe as we can. The second thing I worry about is the environment. I worry about our staff being on top of each other, not having space to go offline and really be able to take a breather so they can get back out there and be ready for the next emergency that comes in the door. It's important that staff have a place where they can be off of this offline, where they're out of the center of the ED. Our rooms are arranged so that if you're in any of those rooms, you can hear even the quietest conversations. So privacy is an issue for us. I had the unfortunate experience of being in our ED about 2 months ago. My care was excellent. I came in with a cardiac arrhythmia. And, but it did give me a chance to see firsthand what a patient experiences. And I was even more dismayed at what our patients face. First of all, the ED is the front door to our hospital. It's the front door, and it gives our patients the very first impression. We look a little shabby. As hard as we try to keep things uncluttered and put away, we're in ED. We're doing emergencies, so things get out of place, and I believe it may give our patients a feeling that things aren't as good as they could be, and I think that's a false impression. We have excellent doctors, excellent nurses, and they deserve to have a space where they can give a good impression to the patient, take good care of them, and patients aren't worried about safety.
We triage people in basically a closet from a redesign. It's not set up well. And what we do is we take critical patients and we have to get a lot of information fast. And when you find somebody that's critical, or a reason that they should be in a bed right away and you have no bed, you have to put them in the waiting room, in a wheelchair, out of sight, where once you go back to take care of all the other patients, you have to remember to look out the window or go out the door to check on that patient and make sure they're still doing okay enough until you get somebody discharged. Because we have no place to put these people that come in that are critically ill. And that's a burden we take on ourselves. And people know this, and they can see it in our eyes when we put people in the waiting room, that, oh, here comes another one, you know, am I next? Or are they before me? It shouldn't be like that.
Hi, I'm Shelley Smith. I'm the nurse manager of the emergency department at Peace Harbor Hospital in Florence. And I've worked for Peace Health for 26 years. And of course, over that time period, I've seen a lot of changes in healthcare, in our delivery, and the expectations of patients and families around the care that they're given, and privacy matters and quality. We're open 24/7. We're probably one of the only businesses that's open in town on a 24/7 basis. So whether in anything that happens day or night, we're the ones that people come to for care. There's just so many more machines that we have to use that we just don't have space for to be able to bring them in and out of the rooms. We also need pediatric equipment and spaces that are suitable for pediatrics or geriatric patients that have special needs. We have one bathroom in our department right now that's used between all of our patients, and that's thoroughly not adequate.
Over the years, as the community has grown, we are busier, and we have not enough rooms for the things that we need to do. We have traumas and an elderly population with a lot of breathing issues and heart issues, and we really need privacy rooms for cardiac things. When we've had codes where somebody's in the next bed and we didn't have any place to put the person in the next bed, so we're trying to work around that, and the family member and the other patient is scared, worried, and doesn't help their situation anymore, and then we have no place for the family to grieve with the patient that's passed. And it would be very nice to have a place where they can go, or just be, that they can be alone with their family member. Sometimes we have to have them go back in the lobby because there's just nowhere to put them during a big trauma. As our population has grown and we have more patients, we have more employees, and our little place we sit and work is just not adequate for what we need. It's very crowded. Patients can just walk in, walk up and see and hear what we're doing, and it's we need a bigger place, and a place where we can see all our patients in all our rooms, and so we know exactly and are right on what is going on. We just need all the help we can get in getting this, because we all love our community and love our patients, and we just want what's best for them.
Our current ED is very small, and one of my main concerns when I'm working is safety for both us and the patients. Because of the way it's set up, right now patients come, they check in immediately at the main nurses station for the ER, which means that patient privacy can be compromised very easily. We have no way we can lock the doors, but if someone comes in who intends to harm one of our patients or harm us, we have no way to basically keep them out, keep us safe, and keep our patients safe. We also currently we deal with quite a few psych issues in the community because there's very limited mental health resources here, and we have no secure rooms, which means that with only 2 nurses, me and a doctor, even when it's really busy, a lot of times one of us has to be one-on-one with a psych patient to make sure that that they're safe and that they do not and to keep our other patients safe while we're waiting sometimes for hours for mental health in Eugene to get back to us. With only 6 beds, when we have a mass casualty incident, a lot of times we have to pull beds from other places in the ER and have them in the hallway, which makes it hard for people to move around. And again, the patient privacy and safety issue comes up. It's something that we are always dealing with, and that means that we have no when we're concentrating on that, we're not giving our full attention to the patients, and that's something that definitely would, if we had a bigger ER, had a dedicated place where patients come to walk in and check in without being right in the middle of our emergency room, I mean, we would be able to triage much faster. Right now we only have 1 triage room, so if 5 people come in at once, there's just a long line right across the hall. They can hear us talking about other patients, discussing cases and things like that. So with this new ER, I think it would mean that we'd be able to really much more effectively make use of our resources and really care for the community.